It is 8:15 p.m. in Trauma Room 1 of a California emergency room. A nurse bends over a stretcher to draw blood from a woman. She notices two things: an oily sheen covering the patient's chest and a heavy, sweet odor filling the air, like garlic and ammonia. She hands the syringe to the respiratory therapist. Inside the plastic tube, floating in the dark red fluid, are pale manila-colored crystals. And within minutes, the ordinary rhythm of the emergency room began to change. Moments later, the nurse collapsed. The therapist, still trying to help force air into the patient's lungs, collapsed next. The syringe held something no one in that room could explain. The woman on the stretcher was 31-year-old Gloria Ramirez. By the end of the night on February 19, 1994, 23 medical staff members at Riverside General Hospital had fallen ill. 5 were hospitalized with severe tremors, apnea, and temporary paralysis. One doctor spent 2 weeks in intensive care with hepatitis and avascular necrosis, a condition where bone tissue starves and dies. Gloria Ramirez did not survive the night. At 8:50 p.m., she was pronounced dead. Minutes after her death, staff were evacuated into the parking lot. A hazmat team in full protective gear entered the empty, ventilated emergency room, sealed Gloria's body in an aluminum container, and moved her into isolation. For months, the press called her the Toxic Lady. Tabloids speculated about illicit drug synthesis and hospital cover-ups. Health officials suggested mass sociogenic illness, a collective hysteria brought on by the strange smell. But hysteria does not cause bone tissue to rot. Lawrence Livermore National Laboratory, a federal facility that builds nuclear weapons, sent in forensic scientists, and their reports said something different. The Riverside coroner's office found no known toxins in Gloria's system. The coroner ruled cardiac dysrhythmia from advanced cervical cancer. But a failing heart couldn't explain the mass fainting. The Livermore scientists started focusing on the fumes and mapped out a chain reaction. Their hypothesis was that Gloria had been using dimethyl sulfoxide, or DMSO, as a topical home remedy for nerve pain. DMSO is an industrial solvent that, when absorbed into the skin, leaves a garlic-like taste in the mouth. This would explain the oily sheen on her chest and the sweet odor in the trauma room. The theory suggested that if Gloria had used DMSO, and if her body chemistry and emergency treatment transformed it through a chain of reactions, it might have produced something far more dangerous. When paramedics administered oxygen in the ambulance, the Livermore report suggests the oxygen bonded with the DMSO in her bloodstream, creating a compound called dimethylsulfone. This compound crystallizes at room temperature. So, it was concluded that dimethylsulfone is responsible for the crystals floating in the syringe. But crystals and gel do not knock out a room of experienced trauma nurses. The final link in the laboratory's theory requires a catalyst. They proposed that electric shocks from the hospital's defibrillator converted the dimethylsulfone into dimethyl sulfate. Dimethyl sulfate is a dense, toxic gas that, after exposure, causes delirium, paralysis, and severe tissue damage. This was a terrifying chemical theory. Independent chemists and the Ramirez family dispute the theory. No one isolated dimethyl sulfate from the hospital air or the body. The only evidence was the mathematical models from Livermore and the medical records of the staff who fell ill. Under biohazard protocols, Gloria was sealed in a casket. Her family couldn't see her and was denied the basic rituals of mourning. 2 months later, when the body was released for burial, it had decomposed. The family commissioned an independent autopsy, but the condition of the remains made it impossible to challenge the county's findings. For 30 years, people have passed this story around as a medical curiosity. The county closed the case. The staff's illness had no official explanation. A mother of 2, in the final agonizing stages of a terminal illness, went to a hospital seeking comfort, and she died alone, surrounded by strangers in protective masks.